As Maria said, we also conducted a systematic literature review of existing curricula on collaborative leadership to really understand which competencies are addressed in those curricula and how they are addressed and what are the impacts of these curricula on learners and the healthcare system. The initial search of the peer-reviewed literature produced over 30,000 articles, and after applying the selection criteria, using a double blinded selection, the number of articles was reduced to 250 peer-reviewed papers on educational leadership programs published during 2000 and 2012. We also conduct a gray literature review by searching websites and conduct surveys to create an inventory of existing healthcare leadership curricula for different learner types within schools of medicine, nursing, public health, business in Canadian university and selected national associations. The result of these literature reviews inform us that a very few educational programs addresses specifically collaborative leadership. In fact, most of them focus on developing knowledge, skills, and behaviors and skills of individual leaders. Moreover, majority of these programs are taught within only one discipline, and only 10% of these peer-reviewed articles presents truly interprofessional education initiatives. Concerning the evaluation aspect, the majority of the programs only evaluate the short-term impacts by measuring the learner's knowledge, skills, and behavior. Only very few of them measure the impacts on system change or on patient and family outcomes. Moreover, none of those programs retrieved seems to give the learner methods and tools to evaluate their own impacts as a leader once the program is completed. Finally, when we checked at the competencies addressed in the program containing elements of collaborative leadership, we found that the most frequent themes were collaborative problem solving and shared decision making. However, even if these elements of competencies are considered in the literature related to collaborative leadership, we still consider them as part of traditional leadership. When we looked at the competencies addressed in those programs, competencies like promoting a new professionalism, answering the health and social needs of the medically unserved, developing a common set of values around social accountability and community engagement, and setting priorities around health concerns of the local community, the region, or the nation. All those competencies are at the very bottom of the list. So based on these results and through the initiative of the IOM, the CIHLC has proposed to develop a new model of collaborative leadership and program for emergent leaders aiming to foster sustainable health system changes. As the CIHLC recognized that community engagement strategies are grounded in the recognition that local, social, and physical environments powerfully influence what works and how solutions must be tailored to be effective in particular context, this program will use the action learning approach. So learners will be invited to develop, implement, and evaluate a project that have the potential to change the system to better answering the needs and priorities of communities. The principles of social accountability and community engagement not only reflected in the pedagogical approach used, but also in the process followed by the CIHLC to develop the program in itself. as well as in the entire content of the program. So the learner will become collaborative leaders who understand community engagement principle and who are able to take socially responsible actions. Finally, another threaded theme of the CIHLC program is the evaluation. So emergent leader will learn innovative evaluation approaches and be provided by evaluation toolbox to be able to evaluate uh, and support the process of change and to evaluate the real impact of their work after the program is completed. So as you can see, the CIHLC program, it's all about collaborative leadership. However, we truly believe that the social accountability and community engagement principles are the anchors of the program. We are convinced that these principles that are reflected in the social contract as well will help individuals to go beyond self-interest and help them to reach a sense of collective intelligence and shared accountability. So the next step for us are completing the development of the CIHLC program, validated with our reference groups, and piloting the first cohort very soon.